Our COVID case rate remains high. The state health department recorded more than 14,000 new cases over the last 2 days, keeping our average of more than 7,000 cases a day. We also lost another 242 people to the virus. The positivity rate is still extremely high, coming in over 18% Tuesday and just shy of 17% today. We haven't seen 18% positivity since the start of the pandemic. As we told you yesterday, Michigan is now the worst COVID hotspot in the nation, and our hospitals are overwhelmed. In fact, the healthcare systems within Region 6, which includes 13 West Michigan counties, put out a plea to the community today asking for help to get back on track. Dr. Dan Roper, the Emergency Department Medical Director for Mercy Health St. Mary's, is here now to talk more about this. Thanks for being here.
My pleasure.
You're at a tipping point right now. Tell us what you're seeing.
We are seeing tons of COVID-19, and we're also seeing a lot of other serious health conditions. So the combination puts us in a state where we're beyond capacity in the hospital right now, which is leading to some wait times and a lot of anxiety among a lot of people.
Yeah, sure. I mean, it impacts all aspects of care. You mentioned the long wait times in the ER, but also delaying surgeries, things like that. Is that happening?
Yes, the hospital is full. We're above 100% capacity right now. So we have to delay some procedures that might be considered elective or semi-elective just to make room for the people that need to be in the hospital for other reasons.
How is your staff holding up?
It has been a long run, and this is one thing that I don't think a lot of us anticipated. We've had staffing challenges. Many industries have lost staff, and healthcare is definitely one of those. It's tiring, it's exhausting, and so we're dealing with less staff than we had during the initial 3 surges, and we're dealing with more patients, which is challenging. You have to both have places to put patients, and you also have to have staff to care for them.
Sure. So today you put out a plea to the community. So what can people do to help?
Well, one thing we learned during the first surge when we delayed just about everything was that people do still need to take care of themselves. They need to take care of their underlying health conditions, and they need to see the doctor when it's appropriate. So the first thing is, do continue to seek care when you need care. But by all means, if you don't need to be in the emergency department, if it's something that can be managed through your primary care physician's office or through an urgent care or testing in other ways at testing centers, we would certainly encourage people to use those other options to allow the sicker people to use the emergency services. Another big one is just trying to do everything you can to not get sick. And that, the big one that you hear about over and over again is the COVID-19 vaccine. But I would also remind people that flu season is coming, and Southeast Michigan in particular is having a big spike in influenza, and it's coming to the west side of the state, so don't forget to get your flu shot as well.
All great advice. Thank you so much, you and your whole team, for what you're doing. We really appreciate it.
It's my pleasure.